Lexington Medical Center has launched a high-risk breast clinic designed to support women who face a greater than average chance of developing breast cancer. While the lifetime risk for most women is about 12 to 13%, those considered high risk face a 20% chance or higher. So for today's Buddy Call, we are joined by Laura Nielsen, the nurse navigator for the clinic, who helps guide patients through their care journey at no extra cost. Thank you so much for joining us.
Thank you for having me.
Okay, so let's lay the foundation by starting with this. What exactly makes somebody high risk?
So on these questionnaires that we have been giving before the screening mammograms, they ask questions about your family history and different things that make you high risk. And if you score high enough, which would be 20% or greater, then you would be considered to be at high risk for breast cancer.
Are there certain factors that can increase somebody landing into that high risk category?
Sure. There are some factors that you cannot control, okay? And these are things they ask about on the questionnaires. Things like your age, the age you started your first menstrual period, the age you had your first child, your family history of breast cancer, of course, is big, and any genetic mutations that you might have that would increase your risk for breast cancer. But there are also some things you can control that will decrease your risk for breast cancer. One of those is maintaining a healthy weight, especially after menopause. That's great for a lot of things, obviously, but it does also decrease your risk for breast cancer. Also, consistent exercise, breastfeeding, and limiting or choosing not to drink alcohol can decrease your risk.
That's so important to know about those risk factors. Now, if someone comes into the clinic, what would their day look like? What will some steps that will happen for them?
Okay, so your first visit to the high-risk breast clinic, you will meet with a care provider who will talk about increased screenings for breast cancer. The average woman at average risk has about usually 1 mammogram a year. If you're considered to be at high risk, then your provider will want you to have screenings probably every 6 months, and they'll use different screening methods besides the mammogram. You may have an MRI or an ultrasound, so they can look at your breast at different ways more frequently. After your screenings, they will see you back in the office to go over the results and to also do a breast exam. And if they find anything abnormal, then they will suggest the next follow-up steps, which may be further screenings, further imaging, or a breast biopsy.
Now, for somebody who's unsure about getting a mammogram, what would your encouragement be for them?
Okay. Well, right now, current guidelines say if you have average risk for breast cancer, you should have a mammogram every 2 years, starting at 40, all the way up to age 74. However, it's important to talk to your healthcare provider about your personal risk for breast cancer, because the mammogram may not be the best test for you, and you want to make sure that your provider is on top of it and telling you the right things to do.
All right, my friends, so you heard it. Make sure to get your mammogram. And of course, we end every Buddy Call the same. Make sure to do your self-breast exam and remind your buddy to do the same.